there. My name's Rhonda, and I'm going to be your nurse today. And I understand that you need a dressing change on your trach. Does that sound about right? Okay, well listen, we're going to get that underway in a minute, but first I need to check some things, okay? I would verify patient's name and date of birth with the MAR. I will establish with the patient a way of communicating with me. So if you start to have trouble, just raise this hand and let me know that you need some help, and we'll stop the procedure, okay? I'm going to go ahead and sit you up. In a nice semi-Fowler's position. I'm going to go ahead and take this pillow out from underneath your head for just a little bit so that we have a nice, good way to get close to your trach, okay? Now, I would gather my supplies. For changing a trach, you need your PPE, a set of sterile gloves, and a trach cleaning kit. You also need some sterile normal saline or sterile water. And you want to make sure that your patient has a good oxygen level during any procedure when you're messing with their trach. So go ahead and you can put on a pulse ox so that you can maintain and see the number to make sure they're maintaining their oxygenation. They don't need foot covers or a hair cover or a biohazard bag. But I do need a gown. And remember, when putting on your PPE, the order you put it on in, you take it off in the opposite order. So you start with your gown. Always tie it in the back. Do not wrap it around and tie it back again in the front. Studies have shown, you know, how important research is in nursing, obviously the part of the gown that gets the dirtiest is the front, so we want to touch that as little as possible at the end. Then would go on your face mask. Hoping you can still hear me breathe. I'm going to open my sterile gloves, open my sterile kit. Inside my kit does come a package of sterile gloves, but as we've seen, Mrs. Lance cannot get those on. Here is a sterile drape, which I can now put on the table. I have created a small sterile field. I'm going to fill up 2 of these containers with normal saline or sterile water. We do not use hydrogen peroxide. This was new, so I did not need to lip it. That will also get the date and my initials on it, that I'm the one who opened it and what date I opened it. Sterile gloves, as you remember. Start with the first one. You're only touching the inside. And on the second one, you're touching just the outside. Now I'll arrange your supplies. The fenestrated. There's my clean. I'm going to get those wet. Okay, and there's my ties. So I'm right hand dominant, so this is going to remain my sterile hand. So I kind of keep it over my sterile field so I don't get confused. Okay, Miss Diddy, we're going to go ahead and I'm going to remove this for just a second, and I'm going to unlock the inner cannula, slip it out, put that oxygen back on. I can look at it and inspect it. I can put it in the sterile water to clean it. I can now use the sterile brush to clean the inside. Scrub off anything off the outside. You can also use the pipe cleaners for this. You can also use the pipe cleaners to kind of dry the inside and the outside, and tap, rinse with the clean, tap off any excess, and then back, whoops, in it goes. And there. That is the part that needs to be sterile, is the changing out of the inner cannula. You still want to have nice aseptic technique for changing out the ties and things, and cleaning depending on how new this trach is and what your patient is admitted for. So I would leave the oxygen close so that they're still getting what we would call in the PD world blow-by. I would take off the old, using my pre-moistened cotton tip applicators, clean the sites from around and out, one swipe per swab. Making sure to clean underneath the cuff, looking at the whole time, assessing for any skin irritation caused by this, how the stoma site is healing, providing oxygen, watching my oxygenation. You can use this. There's two. You can use one. Dampened. If there's really some dry crusties underneath here that you need to get, you can also then use the other one to dry off the area. And then now it is time to put on the new fenestrated dressing. Now to take trach ties. Remember again, we do not generally use twill tape in the hospital anymore, but the procedure is still the same, no matter what device you're using. You are not going to take off the old trach ties until you get the new ones on. And there should be some wiggle room in here because you should be able to get 2 fingers underneath the old trach ties, because that's the amount that you're going to leave. Around the head. Now I would untie, but I haven't unsecured it. And then as I get this one, the new, in, I hope you can see that the new one is in. Now what you don't want to do on a person is just pull this, because what that's going to do is give them a nice little rope burn on the back of their neck. And it should not look like we try to strangle our patients. See, dislodged because it's not tight. So that brings up the point of that holding this while you are doing this is a paramount. Straighten that out again, all nice and tight. Around it goes. And you do want it in a knot, but a knot that is that you can untie if you needed to. Okay? Making sure that I have just about 2 fingers worth of wiggle room in there. So that, my sweet students, is your sterile trach care. Okay, now let me reset this up, and what we're going to go over next is how to do a suctioning. Get that re-snapped back on there. There we go. Okay. And one thing, I want you all to have nice long nursing careers. So always remember to bring the patient up to you. Okay. So then in cleanup, I would dispose of all of this. Take off my sterile gloves. And yes, I realized I've just walked away, leaving the patient, which you would never do. But I think you get the point of how the procedure should go. Now, let's go over how to do the suctioning. For suctioning, we're going to pretend for a second that my patient is back down in the low, bed's in the low position. Call lights in reach. I've done my hand hygiene. You identify your patient. And again, during the suctioning, it's even more important to monitor oxygenation. You even may want to increase their oxygen O2 a little bit to hyperoxygenate the patient, because when we are suctioning, we're also suctioning out that oxygen. So, the things you're going to need. Again, you're going to need your sterile water. Oh, I grabbed the wrong thing. So I will go grab a trach suction. I accidentally pulled up a NG tube. Not the thing we're working on today. So Miss Video will be right back. Okay. So back to supplies. Saline, sterile gloves. Keep a non-set of sterile gloves, just clean gloves in case you need them by your side. And then the suctioning kit. You're also going to need suction, and you want it turned on to where when you have pressure, It should go anywhere you want it less than 120. And I can't get it to work. But in the hospital, it will work. And we're just going over the steps. So keep that nearby. I've explained to my patient how he can communicate with me by raising the hand over there if he starts to feel in distress. So I can stop and put the collar back in place. Again, same position as when you're doing trach care. I'm going to go ahead and in here comes a little cup that you should be able to slide out, open up, and you're not touching the inside. Now this is the saline that I have dated, so it has been opened. So I lip it, and lipping just means you pour a little bit out and then pour in the same spot. Theory being that you are wiping away any of the bacteria that could have grown on there. Here are the sterile gloves that come in the kit. I will try these, but I make no promises. And during your checkoffs, grab a set of extra sterile gloves, because you may have the same problem I've been known to have. These do not fit everybody. But I did get them on. Now, I coil the catheter in my sterile hand. Again, since I'm right-handed, this hand is going to remain sterile. This hand is about to become unclean because I'm about to touch the suction and push it in. Okay? So, clean, dirty. All right, Miss Diddy. The first thing I would do is with my dirty hand, I can operate how much suction I get. So I would suction. That's first, is going to establish that we have suction running. It's also going to lubricate the tube, making it easier to pass and easier for secretions to go through. Then I'm going to coil so that all of this remains sterile, and I know that tip is sterile. All right, Miss Diddy, take a couple of big deep breaths for me. Good girl. I'm just going to unsnap this, if I can, with one hand, and put it close again, going by the blow-by theory. Unravel this. No suction when I'm inserting. And when I insert, you kind of start at a downward angle, and you're going to go until you meet resistance or the patient starts to cough. Pull out just a little bit, and then start applying intermittent suction while twisting the catheter, trying to get out as much of the mucus that you can. And as it comes out, you're going to come over here and suction, suction, suction. See how your patient's doing, watching her O2. Give a full minute in between passes. Allow the patient to reoxygenate. Remind them to take a couple of deep breaths. Good. Keep coughing if you need to. And after a minute, I'm going to see, is my O2 back up to, we'd like 100% before we start another pass, but some patients that's not achievable. Okay? So then we would do one more pass, and you see how that whole time I had this wrapped up, protecting that sterile end. Unwrap. Again, downward motion. Once I hit resistance, back a little bit and start my suction. Twisting, sucking, and out. Clean it up. Okay? Reposition the oxygen. Now, she is just going to have to stay on blow-by for a second. Whoops. Trach collar's very cumbersome sometimes. So again, not ideal, but it'll do for now. Now, when I'm done, I coil this around my fingers, disconnect, and when I take off my gloves, I'm keeping all of the dirty on the inside. Okay? Taking off PPE, gloves come off first because that's the last thing I put on. Then my mask, because that was the second. And then my gown. Gowns, you want to, again, pull. You don't want to touch the front if you can. The whole time you're doing this, you're trying to keep that front and keep wrapping up the dirty things inside. Okay, all of this would now be disposed of. Now I can go ahead and put back on some clean gloves. Correctly fix my oxygen. Again, I'm watching my patient's O2 status this whole time. Reapply the trach collar. Up a daisy. Get my patient comfortable. Oh, is that better? Breathing good. Clean up my mess. Put my oxygen, my suction back up where it belongs. Lower the head of the bed. Make sure my patient has a call light in reach. Let them know if they need me for anything. I'm going to stay with my patient until their oxygenation has returned back to their normal. Ask them if there's anything else I can get you while I'm here. Okay, I'll see about getting you some lunch then, okay? Remember, just because a patient's on a trach doesn't mean they don't get to eat food. A lot of people get that confused. I hope this helps you next week when we're doing our trach checkoffs.